Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
I'm the medical director for the hospitalist program. We work under a national company called Team Health, and my job is to coordinate the 10 physicians that we have, as well as our 2 physician assistants, and make sure that things run smoothly with our group. You know, hospitalists is, our field has been around for maybe 20 to 25 years, but it's really just starting to be known amongst patients and even hospitals. About 2/3 of the hospitals in the country have hospitalist programs right now, and I'm sure that in the coming years every hospital will have hospitalist programs, and there's very good reasons for that. What a hospitalist is that traditionally, if you were admitted into the hospital setting, your family physician would come and take care of you in the hospital and oversee your care and coordinate with the other physicians. But family physicians nowadays, they have a very difficult job, and they're really stretched, and it's very difficult for them to be able to have an office-based practice as well as come to the hospital without their care being sacrificed in some way. So hospitalists have stepped in to try to make sure that patients get very good care in the hospital. Hospitalists are akin to a new specialty like cardiology or nephrology, so heart doctors and kidney doctors respectively. And we're also a specialty because when a patient comes into the hospital, they need very specific kind of care. And the hospitalists that take care of them need very specific knowledge of what's going on with them. And patients are often scared and they're sick in the hospital, and a lot of things can happen in a few days. So hospitalists help them and their families by trying to explain what's going on with them, making them better, explaining what tests they're going to go through, as well as what the results of those tests are, and most importantly, reassuring the patient that those results are going to get relayed to their family physician, and so when they leave the hospital, their family's physician knows exactly what's been going on with them in the hospital. As a young field, we're still always working to get better and better at things, and one of the things that we really need to work on as a field is how to improve that communication between the hospitalist and a patient's family physician. We have a lot of ways. One of the newest things is an electronic medical record, where any of the work that we've done in the hospital can be easily relayed through the computer to a patient's family physician, so they know exactly what's going on with them, what changes were made in medications, what test results were, what discussions were held during the hospital stay. For especially important things, we certainly want to communicate with the doctor ourselves. Nothing is better than doctor-to-doctor communication when it comes to patient care. So we try to pride ourselves on doing that, so that your doctor, when you go and follow up with them, really has a good sense of what went on in the hospital. Additionally, we may write letters to the physician. We may, during a patient's hospital stay, get their primary care doctor involved in their care as well. So there's really a lot of ways that we're doing that, but again, we're always looking for better ways to communicate with a patient's primary care doctor. Additionally, every patient that comes in the hospital, we make sure that they have our contact information to give to their doctor, or if they leave the hospital, we want them to feel like they can call our office, and that just because they've left the hospital doesn't mean that they can't ask questions, doesn't mean that they can't follow up any of the tests that they had. So we want them to make sure that they feel like between when they leave the hospital and when they follow up with their primary care doctor, they still have our support.
For more information, visit us online at conwaymedicalcenter.com.